All right. Hi, I'm Sierra. I'm going to be your nurse today. Could I ask you what your first name and your age is?
My name's Megan. I'm 19.
All right, awesome. Hi, Megan. So, Megan seems to be responding normally, which means that her mental capacity is here, it's alert, and it's oriented. All right, so she's responding to my questions in a proper manner. Her posture is great. Her musculature is great. She seems to have proper nutrition, which is great. And also, she looks like she has dry skin. It's a good color. It's a normal pallor. All right, so I'm going to start my head-to-toe assessment, okay, Megan? But first, I want to let you know, since we are operating under COVID-19 guidelines, I will be wearing a face shield and a mask, and you'll be wearing a mask, and I will let you know when you can take it off, all right?
Okay.
All right, awesome. Okay, so we're going to start off by going over we're going to start at your head, and we're going to go all the way to your toes, okay? It's kind of why it's called the head-to-toe assessment. All right, so first I'm going to start off at your scalp. All right, so I'm going to sanitize my hands first. All right, and so what I'm looking for, I'm just going to touch your scalp, okay? Tell me if there's any pain. Are you in any pain today, Megan?
Nope.
No pain, awesome. All right, so Megan is not in any pain today. Is there any pain here?
Nope.
All right, so I'm just checking to see if her skull is fully formed, it's in the right place. And I'm also checking to make sure that her scalp doesn't have any lumps, bumps, or abnormalities or lesions, so it doesn't, which is great. Her hair is well distributed, and it seems it's very clean, which means you have good hygiene, which is great. All right, so now I'm going to move down to your face, and I'm just going to feel all around your face to make sure that your facial structures, there's nothing broken. All right, good, awesome. Okay, so your face is warm, it's dry, which is great. A normal dry, not an abnormal dry, and there doesn't seem to have any bone breakages, which is great. Everything is normal, structurally speaking. All right, so now I'm going to check your ears, all right? Okay, so I'm just going to feel around your ears. Is there any pain there? Okay, so there's no lesions, there's no lumps, bumps, or abnormalities. I'll check your hearing in a bit, but right now I'm going to check your eyes first. All right, so I'm going to start off by checking your peripheral vision, which is cranial nerve 2, all right? So you're going to tell me when you see my fingers coming up from behind your ear, okay?
Now.
Beautiful. Okay, so they're equal on both sides, and they're both working, which means cranial nerve 2 is fully intact, which is great, Megan. All right, so now I'm going to have you, I'm going to test cranial nerves 4 and 6, which is eye movement, all right? So you're going to follow my finger just with your eyes, not with your head, okay? Great, okay. Was there any pain?
Nope.
Awesome, okay. So that means cranial nerves 4 and 6 are fully intact. Now I'm going to check your pupils, which is cranial nerve 3. Your pupillary reflexes. So if you could just look straight ahead. Beautiful. Okay, so her pupils are equal and reactive to light, which is great, which is normal, which means that cranial nerve, what did I say, 3 is fully intact, which is great. All right, Megan, so now I'm going to test out your hearing really quick, which is cranial nerve 8. All right. Tone is close. It's easier for you to hear. So when you hear this sound, let me know, okay?
Now.
All right. Megan has great hearing, so she can hear from both ears, which is great, which means cranial nerve 8 is fully intact. All right, so now I'm going to ask you to take off your mask. All right, and I'm going to ask you to close your eyes, and I'm going to do a test on smell, which is cranial nerve 1. And so, Megan, I'm going to ask you to tell me what this smell is and when you smell it, okay? Could you block one nostril?
Now, it's alcohol.
Okay.
It's alcohol.
Beautiful. All right, so that means that cranial nerve 1 is fully intact. Good job, Megan. All right, so now I'm going to have you do a couple facial faces for me, okay? So that would be cranial nerve 7. Okay, so I'm going to have you smile really hard, frown really hard and blow your cheeks out. Great, so cranial nerve 7 is fully intact. Alright, so now I'm going to do your oral exam, okay? So I'm going to get a tongue depressor and open that up. And I'm going to use my pen light. And could you open your mouth and say ah for me? Great, so I see that your uvula is midline. I can see your soft palate move when you say ah, which is great. Okay, can you open your mouth one more time? I'm just going to check the sides of your mouth wall. Great, okay, so I can see that there aren't any lumps, bumps, or abnormalities. There isn't any ulcers in there, which is great. Nothing's bleeding, which is good. Alright, so I'm going to check your gag reflex really quick, which will be cranial nerve 9, okay? Good, alright, she has a gag reflex, which is great. Okay, good job, Megan.
Thank you.
Alright, so cranial nerve 8 is fully intact, which is great. Okay, so now I'm going to have you, don't put on your mask yet.
So sorry.
Could you stick out your tongue for me and say light, tight, dynamite?
Light, tight, dynamite.
Alright, awesome. So that means that cranial nerve 12 is fully intact. Good job, Megan. Cranial nerve 12 is fully intact. Okay, so now you can put your mask back on. Thank you very much. Alright, and so I'm going to have you test the last cranial nerve, which is cranial nerve 11, okay? And you're going to press your, before I touch you, I'm going to take off these gloves because I just did an oral exam. Alright, clean my hands. Beautiful. Alright, so now I'm going to have you press your shoulders up against my hands. Good. Press your face against my hands. Press your face against my hands. Beautiful job. Alright, so Megan, you have cranial nerve, what was it? 11 fully intact. Yes, beautiful. All right, good job, Megan. All right, so now that we know that all of your cranial nerves are fully intact, which is great, we are going to move down to your neck. But before we do that, I want to check the sensory on your face. Okay, so that is going to be checking the final cranial nerve, which is cranial nerve 5, okay?
Mm-hmm.
All right, so tell me when you feel this cotton swab on your face and close your eyes.
What, now? 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 Now?
Beautiful. Okay, so cranial nerve 5 is fully intact, and now we know that all of your cranial nerves are fully intact, which is great, Megan.
Great.
All right, so now I'm going to move down to your neck, okay? So I'm going to check and make sure that your trachea is midline. It is. Could you swallow for me? Great. There's no tracheal deviation, which is normal. Is there any pain?
No.
Okay, so there's no lumps, bumps, or abnormalities, which is great. And now I'm going to feel for your carotid pulses on both sides. Good. Good. Awesome. All right, so the next step is to listen to your carotid pulses, or auscultate, on both sides. We're going to listen for them to be equal or symmetric. First, I'm going to clean off my stethoscope. I'm going to be using both the bell and the diaphragm for this assessment in order to hear all types of sounds from the carotid artery, which is good. Just going to clear off my stethoscope. Great. All right. So I'm going to start by listening with the diaphragm in 3 places. Good. Good. Now I'm going to move to the bell. Beautiful. All right. So her carotid pulsars are both there, which is great, and I didn't hear any swishing noises, which means there's no backflow, which is great. All right, so that concludes the neck exam. All right, so now I'm going to start listening to your breath sounds of your lungs, okay?
Mm-hmm.
So I'm going to start off in the front, and I'm just going to palpate your chest area, okay? Let me know if there's any discomfort, okay? All right. So I'm just feeling for any swollenness or deformities or anything like that. All right, so now I'm gonna press my palm against your chest, and you're gonna say 99 every time I do it. Okay?
99, 99, 99, 99.
All right, I'm gonna go underneath your brow. Okay?
Okay. 99, 99, 99, 99.
Good. Okay, so the tactile firmness is equal, which is great. All right, so now I'm gonna listen to your lungs. Okay? All right. Listen to your lungs. All right. I'm gonna listen with just the diaphragm. Okay? Breathe in and breathe out every time I press the diaphragm against you. Okay? All right, beautiful. All right, I'm gonna go underneath your brow, okay? All right, beautiful. Okay, so the sounds are equal, which is what you're looking for, and symmetric. So would you mind spinning around on the bed for me? All right, so now I'm going to do the same thing on your back, except that I'm going to percuss. All right, so I'm going to start off by pressing my palm against your back, and you're going to say 99, okay?
99, 99, 99, 99.
Okay, I'm going to go into your brow.
99, 99, 99, 99.
All right, so tactile firmness is equal, which is great. Now I'm going to percuss all down your back, okay? All right, so that's equal, which is great. And now I'm going to listen. So every time you feel the diaphragm yet again, could you breathe in and breathe out for me? I'm going to go into your brow. Beautiful. So I don't hear any crackling. Everything is symmetrical, which is great. Okay, you can flip back around, Megan. Beautiful job. All right, so that completes the exam on your chest, on your lungs. Okay, so now I'm going to go and I'm going to do the exam on your heart. Okay, so I'm going to start off by just palpating and seeing, just making sure there's no enlargements. Everything's normal around your heart, which is great. It is. There's no swollenness. And now I'm going to listen. I'm going to auscultate to your heart with each valve, okay? And I'll name each valve as I listen to it. All right. I'm going to listen with the bell and the diaphragm, okay? All right, so this is the, so I'm going to start off with the aortic valve. Good, and the pulmonary valve. Okay, and Erb's point. And the tricuspid valve. I'm going to go into your browser. And the mitral valve. And so this valve is right next to the apical pulse, and I'm going to listen to this for a minute. I'm just listening for any murmurs or abnormalities with her heart, any arrhythmias. You can hear some vowel sounds as well, which we'll go over next. Alright, just 10 seconds left. Great job, Megan. Alright, awesome job. So everything sounds normal there. Now I'm going to listen with the bell, okay? Just really quick. Alright. The aortic valve. The pulmonary valve. Erb's point. The tricuspid valve. And the mitral valve. Beautiful. Alright, everything sounds great, Megan. Alright, so I'm going to have you lay down really quick. Okay, so now I'm going to assess Megan's third and fourth heart sounds. Alright, so Megan, I'm going to have you lay on your left side, and I'm going to listen to the diaphragm towards right next to the apical pulse. Alright, and then if I lift up your bra, right ahead. Alright, there are no third and fourth heart sounds. You can lay back down, Megan. Alright, so now I'm going to look for jugular distension on either side. Alright, so could you turn your head to the left? Great, so there's no jugular distension, which means that there's no pulsing right around here in the neck. And you can look to the other side. Beautiful. Alright, so there's no jugular distension. Great job, Megan. Alright, so now I'm going to check both pedal pulses. Okay? I'm going to put on gloves for that. And then we will continue with balance and joint movement, okay? Alright, so I'm going to assess both pedal pulses. Alright, so they're both present here. And they're both present here. Great. Okay, so great job, Megan. Now I'm going to have you do a couple of exercises with your hips, so that way I can see your full range of motion with your hips. Could you lift up your knee, your left knee, or your right knee, whichever one, and spread out to the side, and put your legs straight, and lay back down. Beautiful. And could you do that with the other side? Beautiful. Okay, so she has full range of motion of her hips. Alright, so, gotta put on gloves again. I forgot to do a pressure with her feet. Put this on really quick. Alright, so I'm going to have Megan press down against my hands. Good, equal and strong. Press against my hands, out. Good, equal and strong, and in against my hands. Good, equal and strong. Great job, Megan. Alright, now I'm going to do a sensory test. And so I'm going to show you what it feels like to have the hard and sharp sides of this cotton swab on you, Megan, and you're going to tell me which one's soft and which one's hard. Alright, open this up. Alright, so this is the soft side, Megan, and this is the hard side, okay? Alright, so tell me, could you close your eyes and tell me, is this soft or hard?
Soft. Hard. Soft. Hard. Soft. Hard. Soft. Hard.
Beautiful. Okay, great job, Megan. Alright, now I'm going to do, since you can feel everything in your arms and your legs, which is great, now I'm going to do the abdominal exam. So I'm going to start off by listening, so that way I don't disrupt any of her abdominal noises, which is great. We're going to start off with that. So I'm going to start down in your lower left quadrant, and I'm going to move up clockwise, okay? And make sure the diaphragm is warm and holding on for the end of it and not the bell itself. And I'm listening for vowel sounds. Great, perfect. Everything's normal. I heard vowel sounds in all 4 quadrants, which is great. Alright, so now I'm going to percuss, alright, and I'm just gonna feel and if there's any fluid in areas where there shouldn't be fluid, okay? Alright, beautiful. Okay, so everything's normal there. Now I'm gonna palpate. So I'm gonna do it lightly and then I'm gonna do it harder, okay? Tell me if there's any pain. Alright. Beautiful. Okay. Now you can sit up. Thank you very much. I can take the abdominal assessment. Great job, Megan. Okay, now I'm going to look at your hands really quick. Let me just make sure. So your skin looks normal. It's not too clammy, which is, it's not clammy at all. It's nice and red. It's warm, which is normal. I'm going to check your skin turgor. It's great. Okay, I'm going to check the other hand. Same thing. Skin turgor is normal, which is great. Now I'm going to feel your capillary refill. Great, that's normal. Responds within 2 seconds. Blood flows back into her fingernails. Beautiful. All right, good job, Megan. All right, so now I'm going to do a couple more reflexes. I want to see how your full range of motion is with your arms, okay? So can you put your arms out straight like this? Could you put them behind your head like this? And behind your back like this? And straighten them out. Great job. And now could you do this movement? Good. And this movement? Great job, Megan. Okay, so that means that she has full range of motion in her wrists, her elbows, and her shoulders. Great job. All right, so now I'm going to see if you have equal pressure in your hands. If you press up against my hands, good. Press down, good. Out, and in. Good job. All right, so could you squeeze my hands equally too? Good job. So that's equal. Everything in there is equal. The pressure is equal, which is really, really good to see. All right. Great job, Megan. So now I'm just going to test a couple more things. So I'm going to have you pat your legs like this and flip your hands over and do it as fast as possible. All right, great job, Megan. So she's doing really well with all types of sensory abilities and also reflexes as well as all of her mobility, which is great. Now, Megan, I'm going to have you stand up. All right, and I'm going to have you walk towards me normally. Great job. All right, and turn around and walk back. So right now I'm looking at her hips and her gait, which is normal. She's walking in a straight line and she's not. Do you have any pain, Megan? All right, so she's not in any pain. Okay. Could you walk in a straight line towards me, heel to toe? Great job. All right, so she has good balance. Could you turn around and do the same thing? Back. Good job. All right, so that looks great. Good job, Megan. All right, so now I'm going to have you do one more test. Could you lift up one leg and bend the other leg? Good. And could you do that with the other side? Bend. Good job. Good job, Megan. That looks great. All right, so can you sit back down for me? All right, so that concludes our head to toe assessment. Thank you very much for helping me out today, Megan.
Yes, thank you.